So most people ask about anemia in pregnancy, and there are very many questions around it. So what is anemia in pregnancy? Let's exhaust it today. Anemia means low blood levels. Scientifically, it is having a lower hemoglobin level below 11 grams per deciliter. How do you know that you have anemia, or what are the signs and symptoms of anemia in pregnancy? Commonly, we have what we call headaches. This is very non-specific. There are many more other causes, but anemia can give you headaches. Secondly, commonly we get what we call palpitations. This means you be aware of your heartbeat. You're seated, but you feel your heartbeat beating or racing. In the normal situations, you don't feel this. And when you feel that, just not can be a symptom of anemia. The third one can be irritability. You find yourself very irritable, you cannot concentrate because you don't have the energy. Blood drives the oxygen, the glucose around the body for your body energies and function daily. So you find yourself not concentrating in pregnancy, you are very irritable, and rarely for the severe forms of anemia, you can have the legs swell and many more non-specific symptoms of anemia in pregnancy. Let's talk about the risks and the complications of anemia in pregnancy. One is having a birth before 9 months. That's delivering your baby before it is term. The other common risk or the complications of anemia in pregnancy is having a baby who is of a low birth weight, below 2.5 kilograms, because you have low blood levels. The other one is what we call puerperal sepsis, or getting an infection after giving birth. Lastly, the common complication is maternal exhaustion. You can be in labor, so pushing a baby, and you get tired because you have low blood levels. And these are some of the common complications of low blood levels in pregnancy or anemia. Okay. So let's talk about prevention of anemia in pregnancy, because at the end of the day, it is very important to know how to prevent. There are very many strategies of prevention of anemia in pregnancy. Number one, it starts before even getting pregnant, having that preconceptual consultation with your gynae to know the blood levels that you have, and you can be guided. Secondly, attending your antenatals without missing routine antenatal care. With this, you're going to identify the levels of blood that you have, and you're going to be supplemented by many supplements that will help you boost your blood. Commonly, pregnancy comes with a lot of cravings. One of them is for mumbwa, a common clay medicine made from clay and some other additives. Usually, when you get that craving, it can be a sign of anemia. Many people crave for different things. I've heard of stories of people eating soap during pregnancy because of the cravings. Most of these signs are due to anemia in pregnancy. And when you get such cravings, we usually encourage you to do it in the right way. See your gynae, attend your antenatals, and you'll be given safer approaches to this, other than taking the unsafe pica, different particles that are of no nutritional value. Commonly, we use what we call folic acid in pregnancy for the first 12 weeks or the first 3 months. We give you folic acid, a very simple tablet, tiny, taken once a day, for you to help the body make enough blood. And then when you make 12 weeks, we change from folic, we add iron to it. The challenge is most people don't take this medicine because they don't know the use of it. But the main aim of the medicine is to prevent anemia, to help your body catch up, because the demand is a lot on the body. You remember, you have to make blood for yourself and the baby that is growing in you. So taking these medications that are given to you on a daily is a very important way of preventing anemia. The last preventive measure, there can be many more, but commonly in our setting, is having a balanced diet. If you're planning to give birth, it's better to start early, eating those foods that are rich in iron and folic acid, because these are the minerals the body uses to make blood. So having a balanced diet before getting pregnant, during pregnancy, and you can be guided on which foods. Our setting is rich of these foods. If all we've discussed about anemia is confusing, those are Mary Stopes.
Mary Stopes.
For every stage of woman.